Good day, Mom. So today I would like to discuss the public health issue of COVID-19 pandemic in our barangay. Introduction. Even though the COVID-19 pandemic is a global phenomenon that is heavily affecting the lives, livelihood, and well-being of the entire population in developing countries, where there is poor infrastructure coupled with a low level of education and a high incidence of poverty. The pandemic will result in increased unemployment, decreased income for daily labor, increased food insecurity, depletion of saving and relief measures, and disrupted the marketing systems, among others. On the issue of COVID-19 pandemic, how does the pandemic affect the economy of your barangay? COVID-19 pandemic has a significant impact on our livelihood outcomes. Many people lost their job. Many people suffer from hunger and poverty. That has become treat in your community. How? Yes, many people lost their job again because of the pandemic, and many businesses went bankrupt. What action do your barangay leaders do to fight the infection? It is effective. The barangay leaders the barangay leaders' action is to follow the protocol of DOH by having social distance, wearing a face mask and face shield, always bring alcohol to prevent the virus from spreading, and all should have been vaccinated. And the barangay leaders also help by giving food to the community. So far, it was effective since it lessened the positive cases of COVID-19 in our barangay. What is the current scenario of the pandemic now in your barangay? It is now very different from how it was previously. People have regained their jobs, which are sufficient and good to provide their family needs. Though the pandemic is still present, the situation in the community is much better than in previous years. There were pandemic started, people nowadays can now recover from the pandemic. Conclusion. The outbreak of coronavirus disease 2019 COVID-19 has created a global health crisis that has had a deep impact on the way we perceive our world and our everyday lives. Not only the rate of contagion and patterns of transmission threaten our sense of agency, but the safety measure put in place to contain the spread of the virus also requires social distancing by refraining from doing what is inherently human, which is to find solace in the company of others. Within this context of physical treat, social and physical distancing, and wearing face masks and face shield to prevent the spread of COVID-19. That will be all. Thank you. Oh, shit, sorry. God.